Good morning, everyone. It's Anne Sinclair from Digestive Detective. Yesterday we spoke about what the thyroid is and where it is and what it does. And today I'm going to talk about an underactive thyroid and an overactive thyroid. So thyroid conditions generally are more prevalent in women. This doesn't mean a man can't get a thyroid issue. They can, but it's just more common in women. So let's do underactive thyroid first, which is hypothyroidism. Hypo means things are slowing down. So symptoms of hypothyroidism are based on severity of your hormone deficiency. So you may not experience everything, but you may have some of the things. Signs of this condition don't occur sort of overnight. They happen over a long period of time. The first symptom that you notice probably will be fatigue and weight gain. And they usually go unnoticed. You know, as we're busy, we put on a little bit of weight. But when the metabolism continues to slow down, more obvious symptoms appear. So most common signs and symptoms of hypothyroidism are constipation, depression, dry skin, cholesterol elevation, fatigue, hoarseness sometimes, impaired memory, increased sensitivity to cold, which was one of the ones that I first noticed, irregular menstrual periods or heavier than normal, muscle aches and pains, joint tenderness, pain, swelling and stiffness in joints, a puffy face, slowed heart rate, thinning hair, and for some people it's generally the last third of their eyebrows. For me, I lost all my eyelashes on the bottom, and weight gain. So once there's immune system involvement, this can turn into Hashimoto's, which means you've got raised antibodies. So that's why it's always good when you do a thyroid test, not just a test for TSH. And I know in Australia, it's government policy that unless they see something wrong with your TSH, they won't test further. So for the $155 it costs you to independently test, it's worth doing that if you have any of those symptoms that come up for you. Because the longer you leave it, especially when it hits to Hashimoto's, because that's an autoimmune condition and that needs to be treated in a slightly different way. And the more that's left untreated, it can destroy your thyroid gland. And this damage eventually leads to no production of thyroid hormone. So it's best to try and get on top of it before it becomes too problematic or before it turns to an autoimmune disease. The next one is hyperthyroidism, so everything speeds up. So this refers to the state of an overactive thyroid. So what happens here is the gland produces too much hormone thyroxine, so T4, it produces way too much. So there's generally two categories of hyperthyroidism. One is you're getting an abnormal secretion of the thyroid hormones in certain diseases, like Graves' disease is one, and toxic adenoma, so you have nodules or something like that can be present as well. The secondary hyperthyroidism is by the TSH producing tumours of the pituitary. So risk factors with Graves' disease, it tends to run in families, which is why people with a history of hypothyroidism in the family should always note this is a family history on your medical records and be monitored sort of regularly throughout your life to see that things haven't changed. So some symptoms of hypothyroidism, and they can... The thing with hyperthyroidism is really difficult to diagnose because it mimics so many other symptoms of other conditions. So some signs and symptoms are brittle hair, changes in your bowel pattern, more likely to be looser stools towards diarrhea, changes in your menstrual pattern, difficulty sleeping, enlarged thyroid, again fatigued, increased appetite, increased sensitivity to heat, so you always feel a little bit sweaty and hot all the time, even when everybody else is cold, muscle weakness, nervousness, anxiety, irritability, rapid heartbeat, sudden weight loss, chronic sweating, you get a thinning of your skin, and a fine tremor in your fingers and your hands. So they're the main symptoms of hyper and hyperthyroidism. You can get other symptoms that are individual to you, so it's sort of putting the pieces together to get an end result to see where you are. So again, it's worth getting that tested and paying for that to be tested. Because with the Australian government, they do only test TSH. And for somebody like me who's just been diagnosed with an autoimmune condition, so Hashimoto's, my TSH was perfect in the range, it was 2. So my doctor didn't even consider to test me for anything else. So there is there is something that says it takes about 10 years to be diagnosed by a doctor for your autoimmune condition, and that's just because of the way that we test it in Australia. So TSH is pretty much useless. You need to do the whole panel. So that's it from me for today. Tomorrow I'll talk about some things you can do to see if your thyroid's back on track, and how diet and exercise play a part in your thyroid production. So that's tomorrow's topic. Have a good day, everybody, and I'll talk to you soon. See you.